So this is part 2 of my get organized for nursing school video. As you see, I just got everything laid out because I was studying. So I just wanted to make this video because I said I would show, like, once I start making notes, what my notes look like. So I just want to show some of the supplies that I use when I'm making my notes. These pens are amazing. They write really good, and I'll show you in my notes. These are Paper Mate Flare pens, marker. They don't bleed through, and they have like a really fine tip, so I love these. And this is just a pen bag that I use, put all my highlighters, pens, and supplies in. And as I said in part 1, this is my notebook. I got it separated by the tabs. I won't go into detail because I went over that in part 1, so check it out. So I said I was going to go more into detail about how I separate my notes. So this is exam 1, which is coming up. So under exam 1, I make more tabs, and these tabs, they stick on. I think I paid like $3 for like a set of 24, so they come in good use, and I get these from like Target or Walmart. So it's really helpful when you want to just, stick on tabs. So for under each exam, I make a tab for each concept. So we're talking about perfusion. So we got the shot, the valvular heart disease, the cardiomyopathy, and MI, and so on. So I just separate it so I can just separate each concept within the exam. And then I put all of my notes under that. So for instance, for MI, I have my printed out notes that I read, go over, make sure I know it. And while I'm doing that, it's a lot of information, so I simplify it to where it's easier for me to look at all in one place. And this is my concept map. I used to print out like the pre-printed ones with like the squares and the lines, but I figured it's best to do it this way because some sections, as you see, are bigger than others. So this gives me the opportunity to make my own lines and make the sections as big or as small as I need to. So I separate it like this. Etiology is pretty much the cause. Overview tells what the concept is, what it's talking about, like what's the main thing that you need to know about it. Surgical or procedure. Risk factors. What are the risk factors for this specific concept? Diagnostics. Which tests and which lab tests do you order or look for specifically? Manifestations. Those are like your signs and symptoms. And then pharmacologic. What are your medications to treat it? So concept maps, as you see, is not like, long sentences. It's just like a quick reference. So if I look at this, I'm like, okay, I need to know more information about this ABI. Like, what does that stand for? So I'll just go back in the book and just read specifically about ABI. But this is just like a quick reference, like a quick little guide, all on one page. Okay. Now the next page is more so like your nursing care. ADPI or ADP. It's your assessment, diagnosis, planning, and implementation, and evaluation. So that's your nursing process. So, and I also put like alternative because I couldn't fit it on the other one, and I didn't want to scratch it in. So usually this is what goes on this page, your ADP. Assessment, data, diagnosis. There was a lot for this, so I just said see page 1205 in my Pearson book. Planning, implementations, and then I underline what's really important in implementation. I might go a little bit into detail, like monitor tissue perfusion, and then just to remember LOC or level of consciousness is your first, or loss of consciousness is your first manifestation. So I'll go into detail for things like manage acute pain, and then I'll put priority so that I know this is the priority implementation. And then you have your evaluation, how it evaluates how a successful treatment plan was and what you should see if all of this goes like it should. Okay, so that's how I organize my notes. So I have my printout notes, and then I have my own written notes. Me writing it out, it helps me understand information. Me writing it down and actually condense, and it helps me. So you gotta, like I said, you always gotta do what works for you. And this is what works for me. Just to have everything organized like this helps me to study better. I can just go from concept to concept. All right, so we talked about cardiomyopathy. Let's go to MI. Let's go to EKG stuff, and then heart effects. So that's what I was saying. I divide each exam into the actual concept. So that's what I was saying in my first video. I hope all this makes sense. This is just how I do my notes. People may do it differently. So comment and like or subscribe. Well, and subscribe. Let me know if this was helpful for you. And I will see you on my next video. Bye.